Global health has become one of the definite files of the 21st century. In an increasingly interconnected world, health challenge no longer respects national borders. A virus that emerges in one region can spread globally within weeks. Environmental degradation in one part of the planet affects climate system everywhere. Economic instability in one country can disrupt access to medicines in another. This really does make it clear that health is no longer a domestic issue, it is a global one. The COVID-19 pandemic made this interdependence visible in an unprecedented way. However, pandemics are only one example. Climatic change, antimicrobial resistance, forced migration, fragile health system, and persistent poverty and shape health outcomes across borders. These challenges invited an important question. What is exactly global health and how is it different from public health? The purpose of this presentation is to analyze the evolution and contemporary meaning of global health, to distinguish it from public health, and to critically reflect on its ethical and political implications in today's world. This analysis is based on a quality review of academic literature, including historical overview of global health development, a comparative discussion with global and public health, and received updated definition proposed by leading scholars in the field. Through examining these texts, central themes emerging: the transition from colonial medicine to international cooperation, the emphasis on equality, and the growing recognition that human health is inseparable from planetary health. To understand global health, it is necessary to look at its history. The field did not begin as a neutral or purely humanitarian project. In its early stage, known as tropical medicine, health interventions were closely tied to colonial expansion. European powers invested in this country primarily to protect their soldiers, traders, and slaves in colonized territories. While scientific advances such as Germany theory improved understanding of infectious diseases, medical offers offer reform system unequally and dominate.
Later, in the 19th and early 20th centuries, international health emerged as countries began cooperating to prevent cross-border epidemics such as cholera. International sanitary conventions were created to protect trade routes and economic interests. Although cooperation increased, health governance remained largely influenced by powerful nations. After the Second World War, the creation of the World Health Organization marked a turning point. Health was redefined as a state of complete physical, mental, and social well-being, not merely the absence of disease. This broader vision expanded the scope of international health efforts. Campaigns to eradicate smallpox, expand vaccination programs, and promote primary health care reflected the growing recognition and health is linked to social and economic conditions. However, the fight continued evolving. The HIV/AIDS crisis in the late 20th century reshaped global cooperation, bringing massive funding, new partnerships, and the recognition that health crises can destabilize entire regions. At the same time, critics emerged. Scholars questioned power imbalances between high-income and low-income countries and challenged the paternalistic nature of certain aid models.
This historical trajectory leads to modern concept of global health. Today, global health is a commonly defined as a field of study, research, policy, and practice that prioritizes improved health and achieve equity for people worldwide. What distinguishes it from public health is not the tools to use, but rely on epidemiology, prevention strategies, and policy development, but rather in the scale and scope. Public health traditionally focus on protecting and improving the health of population within a specific national or local context. Global health, by contrast, addresses health determinants and theirs that transcend borders. It emphasizes transnational uses such as pandemic, climate change, migration, and global supply chains for medicines. Importantly, it also centers health equity, recognizing that systematic departments in health outcomes between and within countries are not accidental, but the result of political, economic, and social structures. A recent today's definition further expands the understanding by introducing the idea that global health advances the equality protection and improvement of both population and planetary health. This is a critical shift. It acknowledges that human health cannot be separated from environment sustainability. Climate change, biodiversity loss, and population are not secondary concerns. They are central determination of future health outcomes. The proposed 5Ps framework, people, planet, priorities, policy, and practice, illustrated that global health operates across multiple dimensions. It addresses social systems that affect access to health care, environmental systems that sustain life, and governance structures that shape global response. It is both an academic discipline and action-oriented field grounded in research but driven by implementation and policy.
Yet, a critical perspective reminds us that global health is not free from political tension. Nationalistic movements, reductions in international aid, and weakened global governance threaten progress. The COVID-19 pandemic revealed both the necessity of cooperation and the fragility of global solidarity. Vaccine inequities demonstrate how quickly ethical commitments to equity can be overshadowed by geopolitical interests. Therefore, global health must be understood not only as a technical field, but also as a moral and political project. It requires confronting structural inequalities, questioning power dynamics, and strengthening multilateral governance. Equity cannot remain a rhetorical goal. It must translate into fair financing systems, inclusive decision-making, and sustainable partnerships. In conclusion, global health represents an evolution from colonial medicine and international aid toward a more integrated, interdisciplinary, and ethical grounded framework. It acknowledges that our health is interconnected, socially, economically, and environmentally. While public health protects communities within borders, global health recognizes that those borders are increasingly permeable. Ultimately, global health matters because it challenges to retain responsibility in an interconnected world. Protecting health is not only a national duty, but a shared global obligation. If the 21st century is defined by interdependence, then global health provides one of the most essential frameworks for building a more equitable and sustainable future.